I feel so privileged. Hello. Yeah. Thank you, ma'am, for introduction and good evening to all of you. Uh, it's really my privilege that she was a pioneering principal in the institute which I started my education career, like in nursing education, and it's really delightful to get introduced by her. I already have been warned that there is a time constraint and I should be really, you know, doing it fast. What I realized, I came in morning and I attended most of the sessions. So it's going to be like, my session is obviously on digitalization of patient care. Now it look like it's a like from very much advanced, we are going to come to the bit basic, right? And it would be like, it may sound like it is a summarization of everything, not everything, but most of the point that you have been hearing since morning. So let's go through it. I'm going to, skip all this part because since we are running short of time and directly come to the main thing that I'm going to talk about is digital, how the today's patient care is being digitalized. It's there in India, what main things are getting utilized in India. So I'm just going to quickly come to the my topic. So as far as the patient digitalization of patient care is concerned, the WHO has divided it in a 4 section. So first section is client. How do client or a patient use a digital, how he can use a digitalized care. So the first here is a targeted client communication. So targeted client communication can be like, you want to convey a message. It's a text message from a hospital saying that your appointment is scheduled, or your refill is scheduled, or your prescription needs the revision or updation in a prescription. So that is a targeted client communication. So do you ever get, like, you go to the hospital, one of the, like some corporate hospital especially, and then you get frequent updates that your appointment has been scheduled, or it is your laboratory reports have been sent or something like that. That's a targeted communication. Second is untargeted. Now here untargeted, I would tell you, like for example, there is some health event is happening, like let's say COVID, or there's some epidemic, or there's suppose there are many dengue cases have been seen. So you want to alert the citizens and people in that area, or maybe there is a water source which is contaminated. So you just send the message across the people, and that is untargeted, where you don't have anybody targeted, you just want to give everybody that message. So that is the second thing. Third is client to client communication. So wherein the people can communicate from one end to other, like not between the healthcare sector, just among them. Then patient health tracking. So we can track a health, like nowadays smart devices, wearable devices can be attached or integrated to hospital system, and we can get a data, real-time data of patient vitals and any other like important data into our EMR system. The next is a citizen-based reporting. Now here we talked about that the hospital sends some messages, but over here the patient generally sends some feedback, right? So so do you know how do you how do you contact the hospital? Or because we know hospital keeps contacting us, how do you do that, like with digitalized way? Have you like used any time patient portals? No? I think some of you must have, like if you visit some good hospitals, they have their patient portals. And in patient portal, they give you a safe messaging thread. They give you option to raise your query. And, you can just start chatting with somebody, or they can, you request a call that please call me, I want to talk. So that is how we communicate with us. So patient can also communicate. Then on-demand information service to clients. Yes, on demand is like we call, it's a very simple example. We call some laboratory, like there's an app, we call request somebody and get our sample at the home itself. So that is on demand. Or we, go through the pharmacy app, and we have many Pharma Easy, NetMeds, and you just order a medication. That is on demand service. Then client financial transaction. Yes, even hospital can monitor your transaction, like suppose if you're part of some health scheme where you're getting reimbursement, or how much reimbursement throughout your life you have availed, and how much out of pocket allowance you have been used. So all that we can track with a digitalization. Then going to the second, I'm going to go to the healthcare providers now. So in healthcare provider as a nurses, now here the nurses comes. So in client identification and registration, right? You just need to get a unique ID, you put it in the system, you already know. In morning, Agnes ma'am was talking that, everything, the recent visits, recent treatment, hospitalization, everything is there just in a moment of click if you enter a one unique ID of the patient. So that is a client identification, registration, and health records. Then healthcare provider decision support. Now, I'm going to take a little while here and talk how do digitalization or AI helps us in taking clinical decisions. Like, for example, we know that patient safety, we need to, maybe control infection. So if I insert a Foley's catheter today, make an entry, a EMR system will give me a reminder after 7 days, would you like to change? Or it is, lined up. Or let's say if a digoxin is being prescribed, the AI gives you suggestion, would you like to check his potassium? How is his heart rate for past 1 hour? Because if he's having bradycardia or if he's having a hypokalemia, we would like to reconsider our decision. Then there are multiple, I'll tell you, like CABG patients, they are supposed to get, let's say, like, very less hospitalization is best for the patient, because lesser hospitalization, lesser complications. So, we keep a track. Or 7 days, the patient should be out of the system, or he should be out of the hospital. But when patient is still not in the hospital and his vitals are still deranged, the system gives us a red alert. This patient might need a further hospitalization. I mean, his hospitalization may get prolonged. So these things, these are the ways that AI or a digitalization helps us in taking clinical decisions. There are multiple ways, like multiple ways that it will help us. Then next is a telemedicine, which is a very basic thing. Then health provider communication. I think in morning, somebody was speaking about the staff scheduling, smart scheduling, and all of that. So, I have seen that even people who are working on a transplant team, they communicate with WhatsApp. And that's not really, encourageable, because you cannot really protect your communication. And we know that transplant and all those things are so legalized. And any of your chat gets leaked or something, it's quite a problematic. So it's better we have something digitalized, something of hospital's own system. So, like, we can have such apps where, you can not only communicate regarding your duties, switching, filling in, then, telling that where you can go, about your requesting some different area, all those things, because it is very Herculean task that, tell your manager, I'm not coming, looking for somebody who can replace. So all that, if you, at just one glance, you can see who is available, whom you can request, and you can just switch your duties, you can switch your areas, you can make some conversation which you want everybody to know at one click. Okay, so that is there. Then referral coordinations. Yes, we can. Referral coordination is like, I will know where to refer if the patient is a patient is in certain rural area, which is the closest. So there are data analytic industries who maps out all this. You know what? They take the data of everybody. They will give you the location of each hospital, whether it's a district hospital, advanced super specialty, acute care hospital, long-term facility, everything will be given. And then you can really, it is easy for us where to guide the patient. And, you can really coordinate with the referral services. Then healthcare activity planning and scheduling. Then healthcare provider training. Yes, I think we are almost exploiting in training. I think after COVID, it has been a norm that, online CNE and this and that. And we have YouTube. No, YouTube is obviously social media, but with AI also we can learn the procedures, and even you get a lot of matter. So I think training we are already using a lot. Then prescription and management. Yes, prescription is it has not yet implemented in over here like locally, but you can get a prescription online updated, because now it's a rule that you cannot get a medication on old prescription. You have to have latest prescription. It's like it is quite some year back. So then, but the patient has to come all the way to the hospital just to get one physical paper of a prescription. So that can be done. Then we can have a smart app. Okay, it's already done. Fine. So I think I'll just I think there's a lot. Maybe it's just 5 minutes. I'll talk about what I'm currently doing my PhD, and I have a topic which is related to digitalization. So what I'm doing here is I'm using a electronic medical record integrated digital discharge intervention. So what am I doing exactly over here is I have a hospital system that is EMR system. EMR is actually something that is related to the hospital. EHR, that is health system, is related to across the country, where you will have every incidence of your health recorded. But EMR is generally only for the one hospital. So I have a EMR, and then I have a patient portal. Okay, so now what am I going to do? I'm going to have educative videos which will be transferred to a patient from EMR to patient portal. Okay, so as soon as he get admitted, he'll get a video, he'll get a notification in a patient app that video is there, and they will be coached to see that video. What will be their pre-operative teaching? The next video will come on 4th or 5th day once patient is hemodynamically settled, wherein he will be told about his home care, like what exercise, what diet, what is a wound care, and then 6th day there will be another video which will brief him regarding warning signs. Okay, so anyways, that is one part. This part is called as a help your heart, and there is a subsection called as a get activated. The second part of this intervention is get engaged. Now when the patient is get engaged means as soon as the patient discharges and goes home, that part get engaged will get activated in patient portal, wherein he will be able to get in-depth information about what to eat, what exercises he should be doing, how to do deep breathing exercises, and how to monitor himself for a warning warning signs. So he just have to click, there'll be drop down menu, and he can seek for more information. And I have added third thing is that raise a concern, because many times when patient goes home, he really not aware whether shall I call hospital, shall I go to hospital. Whenever he has a problem, they're always in a dilemma. Should I go or should I call, or is it not like whether I should worry? Because even if how much ever we tell them, they are not exactly confident. So there is a third tab is a raise a concern. In a raise a concern, again, they will have a drop down menu. What is it regarding? Okay, so is it regarding your diet? Is it regarding your exercise? Is it regarding your wound? Is there any seepage or any, some problem? Or is it any other? So there'll be a plain open response. The hospital, those responses will come in the hospital EMR system. And we will be able to, and I have a different interface generated for that. So it will be reflected in my system with my login ID, or it can be given access to the treating physician or surgeon especially. And as soon as we get that concern, we have to contact the person. There is also a possibility that we can have a chat. Okay, if this is a concern, I can just reply. But many times looking at the awareness that patient has at our local level, it may not be very feasible, and there will be a lot of medico-legal issues. So I have dropped that. So I have just put a raise a concern. So this is how I'm going to do. It's just, it's in a pilot. It's fantastic to know, actually get into this software, designing it, giving suggestion, making various tabs. And now I'm look forward to start collecting data, maybe by next month. Actually, there was a lot to tell, but anyway, since this much I could cover. So if you have any doubts or any inputs, you can please give. It's like 42 slides. But anyway, we have to, yeah, I think Arogya Setu app already has been, I also want to notify, highlight that Tamil Nadu was the first state which actually had this comprehensive, this one, statewide health management system, and which was in association with World Bank. And thereafter, state of Rajasthan and Kerala, they also started. And finally, we also had this Ayushman Bharat digital mission. So I had related to that as well. But I think that has been pretty much covered. So anyways, I feel I should just stop because I'm sure it's being really saturated.